Hi, and welcome to our virtual Beehive, Social Determinants of Health, Perspectives and Lessons Learned from Operations to Screeners. Are you or your organization contemplating incorporating social determinants of health screening into your practice or health system? Have you already incorporated them? Our organization has been working on incorporating SDOH questions into clinical care since 2017, and let me tell you, it is no simple task. These seemingly basic questions are in a lot of ways the cutting edge of healthcare, and each clinical setting and practice location provides its own unique set of challenges. And despite what you may have been hoping when you clicked on the link, we don't have all the answers. But we think we've learned some things along the way that we're excited to share with you. I'm Andrew Katz, the Associate Director of Population Health Department of the Camden Coalition of Healthcare Providers. And I'm here with my two colleagues, Giselle and Yasmin, to share a little bit of what we've learned through our CMS Accountable Health Communities model and what it takes to stand up screening in both the ED and outpatient settings. So let's introduce the team.
Hello, I'm Giselle Morales-Schossig, Program Manager for Screening and Navigation on our Accountable Health Communities project. I work closely with screeners, navigators, as well as practices, patients, and community service providers.
Hi, I'm Yasmin. I'm a community health worker / navigator on the AHC team. I began working as a screener in the emergency department and one of our FQHC sites.
As you can imagine, 7 minutes isn't really enough time to go into everything we've learned. So give this more as a teaser. If you hear something that strikes a chord or you'd like to learn more about, we'd love to see you at our virtual Beehive at the conference. Over the next few minutes, we'll give a brief overview of our program and highlight some of our biggest takeaways and barriers. You'll also get to hear directly from Yasmin about the experience of screening a patient and what your staff and clinics can expect. So, as I said, we work on the Camden Coalition's Accountable Health Communities model, a model that was developed by the Center for Medicaid and Medicare Innovation. Our model is focused on screening for issues related to housing, food, transportation, utilities, and interpersonal violence, and provide referral navigation services for eligible beneficiaries and regional alignment to address identified gaps in our region. The tool has 10 questions related to the 5 domains, and then a number of questions related to eligibility and demographic questions. With that background, let's focus on the screening process. So Giselle, let's start with the outpatient practices. What is one barrier to screening an outpatient practice, and what was one way we approached it?
In many outpatient practices, front desk staff, from medical assistants to physicians, already have a lot on their plate. So we went in their office. It was kind of like playing hot potato, as in who would be responsible for the screening. We realized early on that a workflow had to be as simple as possible and needed to understand their structural and cultural challenges. Did we have enough time to do the screening? Could we agree on an appropriate location in the office? Did staff members feel comfortable asking these questions or introducing the screening tool? For most cases, it was both. Adding a new workflow into an already packed schedule does pose some structural challenges. So training was really important to get people comfortable asking these social questions.
And what are some of the ways that we address those issues?
Well, in some cases, we realized that practices just needed more support. We also hired screening staff that could work in their office settings. We provided programmatic support through monthly meetings to discuss rates and process improvements. We actually developed a scorecard that lets practice managers and staff know the screening process and to keep them motivated. We also developed a training video, which is shared with all new staff and used as a refresher. We also have frequently asked questions, postcards that have proven to be really helpful. They're given to patients and is used as a reference for staff. That's to take off some of the pressure of our staff as they're introducing the tool. We also incorporate it in our monthly check-ins.
That's great. Yasmin, you're one of the screeners that Giselle mentioned we hired for certain sites. For you, what was it like to engage patients and ask them questions? Were people open to filling out the screener?
It is very rewarding engaging with patients and addressing their social needs. I try different approaches to engage with patients, and what I found helpful is that if you explain your role in the beginning of the conversation, it adds more clarity. I would usually say we are trying to help patients get connected to the resources in their area, and if they need any help with food, housing, transportation, and paying bills, we can provide the information. And also if they qualify, our community health worker will follow up with them. So by saying this, the patient gets an idea of what are we going to ask. And the other thing that helped me engage to patients was to hand out cards with the resource information. So this way the patients are more willing to participate in the screening.
Great. And you also worked in the ED setting. What were some of the additional barriers to engaging patients that you encountered there?
ED is a fast-paced setting and always busy when compared to an outpatient setting. And in our model, since we are not employed by the ED and we were only targeting Medicare and Medicaid patients, one barrier we had was not having access to the EMR. So we had to rely on the registration staff to identify patients for us. And another thing that I learned is that patients were more open to answering questions about their social needs after they have seen a doctor or a nurse. A lot of patients who come to ER are in pain and anxiety, and they are more concerned about their medical issues. So having their primary reason for coming to be addressed first was really big in getting them to open about their social needs.
Great. That's really powerful insight. We're about all out of time, but there's much more to discuss. So if any of this piques your interest, be sure to join our live Beehive so we can discuss further. We'd also love to hear about your experiences and lessons learned. See you then.